Hello and welcome to a podcast with myself, Dave Gladen, Xpediator Group Marketing Manager, Florence Bearman and Jade Ashby-Rozier from Transaid. Xpediator has long supported Transaid and was delighted to become a corporate member. And today we want to give you an insight of the valuable work that Transaid carries out. Welcome to the podcast, Jade and Florence.
Thank you very much. Thank you.
So we're just going to go through a few questions. Perhaps you can set the scene for our audience and tell us a bit about Transaid.
Sure. So Transaid is an international development organisation, and we were born in the 1980s and actually set up by HRH, the Princess Royal, Princess Anne. So originally we were founded as a response to the famine in Ethiopia in the 1980s, and it was about the bottleneck effectively of aid in the Horn of Africa and specifically Ethiopia. So aid was arriving into the ports, aid that had been donated by people in the UK, but it wasn't getting to people who needed it because the logistics and all of that side of things wasn't in place. So Princess Anne was also the Chartered Institute of Logistics Transport patron. So she came back to the UK and she said, there's all these expertise here that would really make a difference to these people in Ethiopia. So that's effectively how Transaid was born. It soon became clear that transport logistics is crucial to developing countries and is something that often isn't given very much funding. And so Transaid was born as an independent charity, and we are now celebrating our 20th year. And Princess Anne is still very much involved. So everything we do is transport and logistics related, and pretty much all of the support we receive comes from that sector as well.
Thanks, Florence. That's a really insightful introduction. Could you tell us what the main goals are for Transaid?
Sure. So our main goal is to transform lives through safe, available and affordable and sustainable transport. And so we do that effectively in two main areas. So one of those is road safety and the other is access to healthcare. So in terms of road safety, we do a lot of our work around professional driver training. So road crashes are the third biggest cause of death in Africa. And particularly of those aged 15 to 29 years old, and particularly men. So in many cases, it is the breadwinner who is dying on the world's roads or is being severely injured in some capacity, which often means that they can't go to work. So a lot of what we do is building the capacity of driver training institutions. So we started our work around road safety in 2008 in Zambia, working with a driver training centre called the Industrial Training Centre in Lusaka, Zambia. So that's where our road safety work started. We recognised that by building the capacity of local driver trainers using the skills of the industry, those people in turn are able to train the drivers. So it's not Transaid on the ground doing that, it's a sustainable model in which people are able to get the skills that they need to become really good driver trainers, primarily in heavy goods vehicles, buses and forklift trucks, and then be able to scale out that training. So since we started, we have trained over 30,000 drivers, and it makes a huge difference in terms of safety on the world's roads. We no longer just work in Zambia. We also have driver training centres in Ghana, Uganda and Tanzania. And then the other side of what we do is access to healthcare. So that can be anything from working with women in really rural areas in Nigeria and looking at how to get them to health facilities, and in that case using the local taxi services is the best way, or it might be looking at how to get children in Zambia who have got severe malaria to a health facility. So the work is very varied, but the primary focus is transport and ensuring that a lack of transport doesn't limit the way that people live.
Jade, perhaps you can explain how funds are used to overcome the transport challenges in these economically developing countries.
Yes, so one of Transaid's core beliefs is that every driver should be able to leave for a day's work without the fear that they might not return home, be that due to lack of training or dangerous vehicles or roads. So as Florence has already explained, we work with existing partner driver training centres in country to really build their capacity and to share skills from the UK transport and logistics industry to really improve the work that they are already doing on the ground. As well as that work, we also partner with governments and other institutions to raise road safety standards and systems across the board. So, for example, in 2016, we worked in the East African community of Africa to develop a new curriculum, a driver training curriculum, and training manual. And that is really important for us because it means that across those partner countries, driver training is standardised, and when there are drivers travelling across border, it's really important that we're not just focusing on one country and that we are taking an Africa-wide approach. And then another of Transaid's beliefs is that every family should be able to access vital healthcare and that nobody should be left behind. But it's often the people living in areas of Africa, rural areas, that struggle to access these vital services. So again, as Florence has already explained, we try to enable communities living in these rural areas to reach health facilities when they're in need. And the way that we do that is we partner with those working already on the ground, and we strengthen emergency transport systems in those communities, and we provide access to appropriate forms of transport. So traditionally we've used things such as bicycle ambulances, ox cart ambulances, even canoe ambulances in areas where it often floods. And those forms of transport help the communities and the community health workers reach the services that they need. And we also implement a number of emergency transport schemes in which integrate the bicycle ambulances with a number of other measures, including training for community health volunteers. And they help pregnant women, often with complications, but also children suffering from severe malaria as well.
Excellent. So obviously Xpediator become a corporate member early in the year, as I previously mentioned. Can you just perhaps tell us the sort of aspects and the sort of values you look at for when selecting a corporate partner?
Well, I would say that we always look for companies where we feel we can have a collaborative partnership. We like to work closely with companies so that we can improve their business strategies and engage and inspire their employees in order to have a bigger impact in our own work. And we also look for companies where there's a link to what we do and where we feel that that company can bring support and knowledge or expertise to our work. So all of our partnerships are very strategic and collaborative, and each of our partners brings something different and supports us in a different way.
Can you tell us what attracted you to Xpediator as a corporate partner, and perhaps why corporate partners are so important for Transaid and its cause?
So as Jade has already said, every corporate relationship we have is very unique and very different, and the importance of that is that each corporate partner brings a different set of skills. So what really attracted us to Xpediator is partly that as a group you have a whole different range of companies within your brand, and that means that with that comes a huge amount of expertise, ranging from things like warehousing through to HGV training, through to admin experience as well that we need, and that's really attractive. It means that we can engage with employees across all levels of your business in a different way, and we hope that it also means that each different level of your business will get something from the partnership with Transaid as well. So that was something that we were really excited about. Also, our corporate membership base is really diversified over the years, and it started out largely supported by the manufacturers, so particularly the HGV manufacturers. we are now moving into different areas, and we're really excited to have a freight forwarder as part of what we do. And that was something that we didn't really, that was an area that we hadn't really moved into until sort of the last 2 or 3 years. So again, the more companies we have with different sets of skills, that means that the more we can support our programs. And they challenge us all the time by saying, well, actually what we need now is rugged terrain forklift training, for example, and we need to be able to have a membership base who can respond to those needs. And so being able to add Xpediator to our corporate partnership group of supporters is just fantastic, because it really helps us fulfill that.
And and we're obviously really pleased to hear that as well. So perhaps could you just explain the challenges that the sort of biggest challenges that Transaid faces as a charity?
Yeah, I mean, the biggest challenge for any charity, I think, is always going to be funding and where that funding comes from. I think particularly in our case, because road safety is not seen as a particularly sexy cause, and it's not something that a huge amount of funding is available for either. So we're funded in 2 main ways. So one of the main ways is the support of the transport and logistics industry, and a lot of that comes from our corporate partners. But the other way is through institutions and sort of global funders, so people like UK Aid, for example, or US Aid or Comet Relief. But in many cases, that funding isn't there for road safety. It's there for healthcare, and it's there for education and many other very important causes as well. But that poses us with a problem. It means that a lot of the road safety work we do has to be funded by our transport and logistics supporters. That's fantastic, because obviously people like Xpediator understand why we do what we do and the importance of it. But it means that we have to raise a huge amount of money from our corporate partners and through the fundraising challenges and other methods of support to be able to ensure that we are able to train drivers and we are able to make roads safer.
Excellent.
I would also add that corporate partners enable us to test and try out new ideas. So we've talked about bicycle ambulances and how important they can be in helping communities reach health facilities. But without the money raised from the UK transport and logistics industry, we wouldn't have been able to trial the use of bicycle ambulances in one community and then scale up funding from the global community to reach more people. So it's that funding from the industry which is really important for us to be innovative and to try new ideas which are going to have the biggest impact.
Okay, I think that takes me nicely to my final question. I think for our listeners, it'd be nice to hear some of the successes that Transaid has achieved, as I'm sure there's many of these.
I think there are probably 2 things that stand out in my mind. I think one of them would be the Uganda driver training program, which we started in 2016. As we've just said, global funding for road safety is very hard to come by and almost non-existent. But in 2016, GIZ, who are the technical arm of the German government, came to us, and in collaboration with them and with their funding, we've been able to set up a new driver training centre in Uganda. I think that shows us that all of the work that we do around road safety that has only been made possible by corporate partners like Xpediator is being recognised by the international community, and that road safety is starting to be recognised as something that we have to fund and that we really need to talk about more. So for me, that was a huge success, and that project is going really well. And then the other one would be our Mamas Against Malaria programme, which was a 1-year pilot in Zambia, building on some work that we'd previously done around bicycle ambulances and how you get pregnant women who live in very rural areas to health facilities when they go into labour. So this project was specifically around malaria, but it had many of the same issues. So what do you do around medical supply chains? How do you actually get patients to health facilities? How do you ensure that there are people within the community who can spot when someone is in trouble, however, whether we're talking pregnant women or whether we're talking severe malaria. So that project, it was 12 months long, and we worked with a small amount of people in a community called Serenge. It was about 50,000 people, But during that pilot, we saw a 96% reduction in the deaths of children under 6 from severe malaria, which completely passed our expectations. We weren't expecting it to be that successful at all. And it was an example of how a really good supply chain, really important and innovative transport solutions can really make a difference to a community. Then we got to the end of that project, and it was, well, what are we going to do next, and how are we going to make sure that everything we have learned from this project continues? And so a huge amount of work went into seeing how we could scale up the project. A lot of the support originally also came from the transport logistics industry. People bought bicycle ambulances because they really thought that was an amazing use of actually not very much money. We can build a bicycle ambulance for £520. And then the Canadian government could see what we were doing and gave us a huge scale-up grant to be able to implement that project in further communities. So now that project is underway. We're reaching 225,000 people, so it's almost 4 times as big. And we're now busy getting more bicycle ambulances in the community, more drugs, more people trained, and so people are going to be ready for the malaria season when it arrives.
Thanks, Florence and Jade. It has been great having you on our podcast and sharing details of the valuable work Transaid carries out. I definitely look forward to catching up again soon.